gosh, I just can't do this anymore. And when you kind of meet people with more negative attitudes towards what you're doing, like thinking, oh, this is another Yank trying to make a difference in South Africa, how did you deal with that?
Those two questions probably answer each other. So yes, there are definitely points. I mean, the joke answer is every single day I think this is too hard, I don't want to do it. But the real answer is, yeah, there are a couple points where I can remember along the way where I was like, this isn't worth it. You're talking to a newspaper and they're going, well, why aren't you helping, America? There's so many sad things here, and there are. And my answer is, we're a product of our experiences, and this is one that I have had, and I'd like to share it with people who want to experience it also. So that answer is, when it gets too hard, it is hard, but there's people relying on you to give back what you have. So there's people now that are relying on not only me as a person being lucky, but Eyes on Africa as a body that now exists and is somewhat substantial, So there's that, but when you run into those people who just give you a really hard time, I guess that's more motivating to answer the other question. So when I'm feeling down and then I run into someone who says, oh, it's not worth it, you shouldn't be doing this, that's all wrong, then I go, well, I'm going to do it even more now, just in spite of you. And that's that young rebellious spirit, which you should never lose. People go, oh, well, that's what's terrible about teenagers, I guess. But that's what's great, is that we're fueled by I don't know, competition or someone challenging us. And when you're working for a good cause and you're fueled by someone challenging you, that's the best thing that could ever happen.
All right, good stuff. Thank you. Well, nice.
Hi, I'm Rishi, and I'm from Kenya. And my question is basically that there are many organizations that many young people would like to start organizations, but there are very few that reach the stage that your organization has reached there. So I understand that things that everyone does is the same, but if you want to reach a certain stage, you need to do the things a bit differently. So what were the small changes that you made in the process that at least I can say as your organization has been better than the others? Okay, I can't say at least it's been very, very, very good at least. Yeah.
So I guess the way that we started was lucky, and you guys are in the exact same spot that I was, so this applies to you. But the way that I was able to travel to South, I didn't go to South Africa with an organization going, man, I want to find some causes. We got all this money lying around. We want to donate it. I mean, that was like the fuel for it. So you start with an informed passion. It's not just, oh, I want to build a school in Uganda. I've never been to Uganda. I don't really know how to build a school. And there's definitely people, and they contact me and they say, I heard about your organization. This is what I want to do. And I think that maybe is the difference, is you legitimize yourself. So some organizations might have said, great, we're building a school in Uganda now because somebody wants to. Well, okay, that's great, but you have to educate yourself on that area. And it doesn't necessarily have to be going. I was fortunate, like you guys are fortunate, that you have been places that need help. So, I was informed about some of the areas of need, and so I can make a better pitch than some. Whoever is trying to build a school in Uganda that's never gone or doesn't really have any plan. You set out your steps and you say, these are our goals, and all I need from you is $50, and if you want to come, that's even better. So that would probably be like the first answer, is just, try and make yourself as legitimate as possible. Make yourself seem like an adult, which impresses people even more. I mean, we know that adults don't really know what's going on, but every adult doesn't know that we know it, so play it to your advantage. Thanks.
Hi, my name is Alima. I'm from Kenya. I wanted to ask, are there any forms or forums that Eyes on Africa use to educate people on prevention of AIDS? Because as much as everybody thinks everybody knows about AIDS, there's people who don't, or think it only happens to them and it can't reach me. Are there any forms of education that you use for prevention?
Absolutely. That is something that Eyes on Africa itself has not really expanded into yet. But with this trip that we just took, we're now going into mobile outreach. It's like our big theme. And I think for the entire organization, forevermore, is going to be mobile outreach, taking the success of this mobile caravan and expanding it into a vehicle that is used by pre-existing organizations to go in and do education, as well as testing, as well as skills training, as well as come drive the vehicle and we'll try and get you your driver's license. Trying to utilize this thing as much as possible. So we, as an organization, haven't done it. Now, I have participated through ISLP, which is and education procedures and things, but we don't have like certain papers that we hand out as an organization or something like that. But it's something that I'd really love to get involved in, and I think that this community center in Namibia, which is going to have a library in it full of medical papers and different information things and all of that, is a great place to start, as well as this new mobile outreach plan.
Hi, I'm Elizabeth, and I'm from Oregon in the U.S. I was just wondering, once the people get their results back from the HIV tests, do you continue to treat them, or are there reliable health systems in South Africa available to them?
South Africa has, it has unique problems for sure, but if you're able to seek out medical care, there are answers for you a lot of the time. So Eyes on Africa does not continue treatment, as its body. We're not quite ready for that, I guess, since we're only 2 years old. We don't have our own doctors, we don't have things like that. So we partner with these organizations, and the way it works for Edifani with this mobile trailer is that they come and they get tested, and if they test positive, and nobody knows because they're in this kind of fenced-in area, no one will know, is that we refer a counselor from Edifani, our organization that we partner with, to be with them forevermore. So as long as they're alive, literally, this one person is their friend, and they see them at least once a week. So they walk to them, and that's what we did this trip, is we provided some cars for these people who walk all across everywhere to visit all their clients. But so we pair them up with a counselor who is their friend, because so much of the stigma, unfortunately, eliminates family and friends some of the time. So we provide that for them, as well as direct them to locations for treatment. And this counselor keeps them up on, their antiretrovirals that they're supposed to be taking, and really is there to monitor how well they're doing and point them in the right direction whenever they go astray. So we do continue care, but not as Eyes on Africa.
Great, thank you.
Hi, my name is Aisha, and I'm from Turkey, and I'm going to be asking the last question. So there are many foundations that are helping Africa. How did you come up with the idea of making your own foundation, creating your own foundation, instead of joining around the foundations and working?
That's a great question. And my answer would be that I saw sort of something that didn't exist, which was, number one, a story of being young. So all of these organizations are huge. And so much of what we hear about donating to Africa is that, there's so much administration, and they work with so many governments, and some of it can get lost in the process. And I don't know, because I don't work for those organizations, if it's true or not, but that fact that people say that is true regardless. So I want to start fresh without that stigma attached to it. So that's number one, is that we don't have any type of reputation, which is a problem and a great thing all at the same time. So that's number one. And number two is just that if you hand me $50 tonight, I'm going to take your $50 and go to Africa and give it to the neediest person. And it's never going anywhere, There's something about that just personal, look at my smiling face, I swear to you, and here's your tax deductible receipt, that it'll go to the right people. And people love that personal connection. They can get to know each individual donor, the campus coordinators across the school, their friends and their organizations that are donating. And it's always that personal touch that Eyes on Africa gives people that I think sometimes other organizations, that you go online and scroll down how much you want to donate, which you can do with Eyes on Africa, and that's great, but that's not where the bulk of our funds come from. They come from the personal relationships, which aren't even mine. They're spread out everywhere now, but it's just that personal touch that we offer.